Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. Today is February 21st, 2013. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I have been practicing naturopathic medicine in Hawaii for the past 24 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. I'm very excited about the programs that we have lined up for you over the next few weeks. In the upcoming weeks, Ron will be joining us to share his incredible story. 3.5 years ago, Ron came in to see me bound to a wheelchair, struck down in the prime of his life by multiple sclerosis. Tune in to watch Ron run into the studio and learn how he beat multiple sclerosis with naturopathic medicine. You've watched many of my patients overcome incurable chronic disease over the past few years. Did you ever wonder how naturopathic medicine would do against a severe skin infection? Don't miss Dennis share his story of how naturopathic medicine cured him from one of the ugliest skin infections you may ever see. Yes, we have pictures, and you may actually be seeing some of those pictures right now. We also have some of your old favorites joining us. Many of you ask how Jason is doing. Is Jason still alive? Well, Jason will be joining us for a third time in the last 5 years to share how he's still beating the incurable genetic cancer of von Hippel-Lindau disease. I'm sure many of you wonder, after watching these patients with psoriasis come and go from the program, is that psoriasis going to come back in the next few months? Evelyn and Annette will team up and show you just how well they're doing against that nasty skin affliction, psoriasis. Yes, you don't want to miss the next few programs. I promise you they will be very, very interesting. Today's topic and guest is just as interesting and exciting, so stay with us because Michelle is joining us to share her horrifying story of living within arrhythmia and beating it with naturopathic medicine. So stay right here. Before we go any further, let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that the human body has the mechanisms in it to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Many of you have never experienced the power of naturopathic medicine and the unparalleled healing force of the human body. Since I began my practice in 1988, naturopathic medicine has literally helped thousands of my patients recover from the most severe and life-threatening diseases and many other chronic ailments that conventional medicine provided no answers for. On this television program, my patients share their courageous and inspirational stories with you. If I may say so myself, their stories of recovery are incredible, amazing, and heartwarming. I hope that their stories provide you an understanding of how naturopathic medicine can harness the tremendous healing potential that God has instilled in the human body to heal itself. Please enjoy their stories. Our hope is that they inspire in you the hope that true health is attainable and that you can have it whenever you are ready. Today you'll see how another patient of mine cured herself from a potentially dangerous heart condition called an arrhythmia with naturopathic medicine. Stay with us to learn about arrhythmias, what may cause arrhythmias, how conventional medicine treats this cardiac problem. Stay with us to hear Michelle share her inspirational story of how naturopathic medicine helped alleviate her potentially dangerous heart problem. Before we introduce Michelle, let me give you a brief introduction into the world of arrhythmias. An arrhythmia is a problem with the rate or rhythm of the heartbeat. During an arrhythmia, the heart can beat too fast or too slow or with an irregular rhythm. Most arrhythmias are harmless, but some can be very serious and life-threatening. During an arrhythmia, the heart may not be able to pump enough blood to the body. Lack of blood flow can damage the brain, heart, or other organs. The heart is basically a pump. Its main purpose is to pump blood throughout the body. The heart itself is a hollowed out muscle that is lined with nerves. The nerve fibers receive electrical impulses that cause the heart to contract or squeeze from the top of the heart to the bottom, pushing the blood forward and out to the body. An arrhythmia occurs when the heart receives electrical impulses in an erratic fashion, causes an incoordinated contraction or irregular heartbeat. There are 4 types of arrhythmias: premature or extra beats, supraventricular arrhythmias, ventricular arrhythmias, and bradyarrhythmias. Premature extra beats are the most common type of arrhythmia. They're harmless most of the time, and usually don't cause any symptoms. When symptoms occur, they usually feel like a fluttering in the chest or a skipping of the heartbeat. Supraventricular arrhythmias or tachycardias start in the atrioventricular node, otherwise known as the AV node. Tachycardias are fast heartbeats. The AV node is a group of cells located between the atria and the ventricles. Atrial fibrillation or AFib is the most common type of serious arrhythmias and involves a very rapid and irregular contraction of the atria of the heart. In an AFib, the heart's electrical signal doesn't begin in the normal sinoatrial node. Instead, they begin in another part of the atria in the nearby pulmonary vein. These signals don't travel normally. They spread throughout the atria in a rapid and disorganized way. This causes the atria to quiver very fast or fibrillate instead of beating normally. As a result, the atria is incapable of pumping blood into the ventricles as they should. This can cause the blood to pool in the atria, causing clots to form and potentially triggering a stroke or reduced blood flow to the body and producing congestive heart failure. In AFib, the damage to the heart's electrical system is often a result of other conditions that affect the health of the heart, such as high blood pressure, coronary heart disease, and rheumatic fever. Therefore, inflammation is thought to play a key role in the development of atrial fibrillation. Atrial flutter is similar to atrial fibrillation. However, the heart's electrical signals spread throughout the atria in a fast and regular rhythm. Atrial flutter is much less common than atrial fibrillation, but has similar symptoms and complications. Ventricular arrhythmias start in the lower chambers of the heart in the ventricles. It can be very dangerous and require immediate medical care. Ventricular arrhythmias include ventricular tachycardia and ventricular fibrillation or VFib. Complications of ventricular arrhythmias are cardiac arrest, strokes, and congestive heart failure. To prevent death, the ventricular arrhythmia must be treated swiftly with electric shock to the heart called defibrillation. A defibrillation device may be implanted on the heart to prevent VFib from escalating or ventricular fibrillation. Arrhythmias can be caused by smoking, heavy drinking, recreational stimulant drug use like cocaine and amphetamines, and too much caffeine or nicotine. Arrhythmias are more common in people who have had a heart attack, heart failure, cardiomyopathy, leaky or damaged heart valves, congestive heart defects, high blood pressure, diabetes, infections that damage the heart muscle, sleep apnea, and overactive or underactive thyroids. The common symptoms of arrhythmia are palpitations, rapid heartbeat, slow heartbeat, irregular heartbeat, heart palpitations or rapid thumping inside the chest, anxiety, dizziness, weakness, lightheadedness, fainting, shortness of breath, chest pain or pressure, fatigue, sweating, and shortness of breath on exertion. If you have these symptoms, schedule an appointment with your primary care provider or cardiologist immediately. Common arrhythmia treatment includes medication, medical procedures, and surgery. Antiarrhythmic medications can be used to slow down a heartbeat that is beating too fast and change an abnormal heart rhythm to a normal, steady rhythm. Examples of antiarrhythmic medications are Maltac, amiodarone, and propranolol. Common medications that are used to treat atrial fibrillation to slow a fast heart rate are beta blockers like metoprolol and atenolol, and calcium channel blockers such as diltiazem, amlodipine, and verapamil. Beta blockers and calcium channel blockers are medications that are also commonly used to treat high blood pressure. In the case of atrial fibrillation or ventricular fibrillation, anticoagulants or blood thinners are prescribed to prevent the formation of blood clots. Preventing clots decreases the risk of having a stroke. Warfarin or Coumadin is one of the most commonly prescribed anticoagulants. Frequently, though, aspirin is recommended in addition or instead of anticoagulants. If the medications fail to work well, or in the case of supraventricular tachyarrhythmias, ablation therapy can be used to burn or kill the damaged nerves in the heart to stop the arrhythmia from occurring. If all fails, then occasionally a defibrillating electronic device or pacemaker may be hooked up to the heart to provide a regular electronic impulse to reestablish normal contraction and rhythm. In naturopathic medicine, we typically look for a potential cause of an arrhythmia by looking at the patient's past medical history that may suggest an imbalance in phospholipidase enzyme levels that may affect normal cardiac rhythm. If one cannot be found, the naturopathic physician may use a cardiac electrolyte formula to balance electrolyte levels. The heart's nerve system is similar to a battery that produces an electrical charge to run a car or iPad. These batteries contain electrolytes such as zinc, manganese, chloride, and potassium, for example. Once these electrolytes are used up in the battery weakens or dies. Within the heart, if the electrolyte levels are out of balance, this may cause an irregular rhythm of the heart. Remember, arrhythmias are serious cardiac conditions and potentially fatal. Do not attempt to treat yourself without supervision of a medical doctor, a cardiologist, or a naturopathic physician. Naturopathic medical philosophy is to look for and treat the cause of the illness or condition. In today's case, arrhythmia, medicine and science says to make the heart beat regular or to slow it down. It sounds like a very good idea, but what is the cause of the irregular heartbeat or the arrhythmia? Could a situation develop where there is too much enzymes being produced or an electrolyte imbalance that may produce the arrhythmia? Well, that's enough about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine so that you can get a better understanding of how this safe and effective form of medicine works. Let me introduce tonight's special guest. My patient Michelle is joining us. Michelle, welcome to Island Wellness, and thank you so much for coming down and sharing your amazing story with us tonight.
Thank you. It's an honor to be here.
All right, Michelle. Today we're talking about arrhythmias. Would you share with us what health issues brought you in to see me?
Yeah, sure. When I first was diagnosed by my conventional doctor, she had noticed a flow murmur in my heart. And after that, and to make a long story short, she basically sent me through a battery of heart tests, from a heart monitor, EKG, ultrasound. I did the stress test, and put me on some conventional medication, and it just seemed to continue. It never subsided.
It never helped?
It did not help.
About what time was this?
This was back in 2006.
Okay. All right. And then what did you do after that? I mean, you went through the typical treatment for arrhythmias.
Yes.
Taking medications.
Taking medication every day, and I found that the medication just really fatigued me ultimately,
Okay.
and I just felt toxic, to be perfectly honest.
Okay.
And my mother has grown up with a lot of Eastern philosophy. I grew up in Hong Kong, and so as a little girl, my doctor was a Chinese herbalist. I never had a Western doctor, so naturopath, homeopathic remedies were not foreign to me, but I knew. For me at the time, I didn't have the patience to go through that process, but I knew ultimately that I needed to seek a naturopath.
Okay.
And a friend of mine recommended me to you, and on a wing and a prayer and lots of faith, I came to visit you, and with the hopes of you being able to help me not only rid the arrhythmias, but also get me off of the medication.
Okay. Do you recall which medications you were on at that time?
I do. I was on atenolol. I was also on meclizine for a little bit of vertigo that she prescribed for me, and I was also on a beta blocker. Okay. Calcium channel blocker and a beta blocker. Correct. Very common medical treatment for arrhythmias. Did your cardiologist tell you what type of arrhythmia you had? I believe it was a PVC.
PVC, okay.
Post-ventricular, something
pre-
like that. Or I don't.
Premature.
Thank
ventricular
you.
contractions.
Thank you. Thank you.
Okay, so tell the audience about the palpitations and the anxiety you felt.
When they first started, I thought, oh, maybe it was just my heart was skipping a beat, and I looked it up online, and of course, everybody tries to go to the internet to seek knowledge and answers, but I read that it was somewhat normal, but my occurrences were a little bit abnormal because it would happen almost to the point, Dr. Uchida, when I ate particular foods.
Oh, okay.
And when I would eat those particular types of food, and those types of food were generally not the healthiest.
Okay.
Or if I had, I'm not a big drinker, I'm not a drinker at all, but if I had a glass of wine or a beer, it would trigger them. And at the time, they would come on quite frequently.
Okay.
And some of them would last a little bit longer than others. And so that, of course, then triggered my mind, because it is such a powerful thing.
It is.
That I thought, oh my gosh, is something really wrong with my heart? And because your mind starts going, then your heart starts to go. And when your heart starts to go, then your mind starts to go even more.
Right.
And then I would start to get very, very anxious and have, literally panic attacks.
Okay. Anxiety attacks are
Yes.
very common when you have arrhythmias.
Okay.
So I'm pretty sure you knew that before. So
I learned that quickly.
Okay. So most people, though, let's say, have never experienced a arrhythmia or heart palpitation. And it does have a particular feel to it.
Yes.
Would you mind sharing with the audience how that felt for you?
Sure. It kind of feels like your heart is skipping a beat, but soon after that, you get a very lightheaded sensation in your head because obviously the blood didn't, your muscles weren't contracting enough for the blood to get to your head. So I felt a little bit lightheaded.
Okay.
And then after that, it would subside, and then maybe it would happen 2 or 3 more times. And I would feel my heart, and it would feel as if it was trying to catch up to its rhythmic beat.
Okay.
Does that make sense?
That makes perfect sense, and I think you described it really well.
Thank you.
So, common symptoms with an arrhythmia is anxiety, lightheadedness, or dizziness. But you also experienced a few other symptoms along with the arrhythmia way back when, as well as more recently. We'll talk about that in a bit.
Okay.
Okay. What other symptoms did go along with the arrhythmia?
I was also, like you were saying, I was getting very lightheaded at times, dizzy, more vertigo type symptoms. I also felt as if with the panic attacks or the anxiety attacks, I would get not super tight in my chest, but just, a heavy sensation. I'd maybe get some sweaty palms, sweaty feet a little bit. I was never like full-blown sweaty, but I just knew that my palms and my feet were sweaty. I would get a little bit of brain, actually not a lot of brain fog,
Okay.
feel just very, not disoriented, but just very unsettled.
So very common classic symptoms, though, for an arrhythmia, with lightheadedness, the sweating of just sweating palms and feet, but you could be sweating almost anywhere. So vertigo is severe dizziness, though,
Yes,
right?
yes.
Not just light dizziness.
Yes.
You were severely
Yes.
dizzy.
Yes.
Would you explain how that felt for
Yes.
the audience?
Very debilitating.
Okay.
Very debilitating. When I could start to feel the anxiety come on, and then, of course, as I mentioned, how powerful the mind is. When you let it race and it goes down the wrong path, it certainly can trigger a lot of other, symptoms. And with the vertigo, I felt like the walls were coming in, and the floor and ceiling were kind of boxing me in, and I didn't feel like I was gonna pass out per se,
Okay.
but I felt as if I would maybe fall over because I
Okay.
did not have my balance.
Okay. Fairly severe symptoms, probably producing more anxiety. in you.
Correct.
Okay. Was the anxiety fairly debilitating for you?
It was both mentally and physically.
Okay.
You know, I had multiple trips to the ER because I didn't know, you know, what was really going on, and I will tell you, Dr. Uchida, time and time again, you know, they kept, you know, they did just about every test known, you know, that they could,
Mm-hmm.
and nothing came up, you know, nothing was showing wrong, and for me it was more mentally taxing because it's like, wait a minute, I really am not feeling well. I
Mhm.
promise I'm not feeling well,
Mhm.
but yet they're telling me everything is fine. I'm like, but you don't understand. And going back to your question, why did I come to see you? That was part of my other prayer, that I was like, oh God, dear God, I please pray that Dr. Uchida would please understand how I felt, because conventional medicine was not.
Okay. Yeah, that was part of the question, was why did you, I mean, arrhythmia is a very serious, or can be a very serious
Right.
cardiac problem. And yet you chose to see a naturopath to try to help. But I guess one of the reasons is because you weren't being offered much help
That's right.
by the conventional medical
That's
doctor.
right. And the help that I was receiving was more medicine, more medication.
Mhm.
And I knew that I did not want, you know, my body was already toxic in some way, shape, or form because
Mhm.
it wasn't responding, you know,
Okay.
normally.
Mhm.
So I didn't want to add fuel to that fire. And we, you know, back in the day and you know, studying history books, you know, we didn't have modern day medicine like we do, so the body had to heal itself, you know, when humans were, you know, in the 12th, 13th, 14th century.
Right, right.
So I knew that there was a hope and light at the end of the tunnel with naturopath. I was just praying that you would be able to be my salvation.
Thank you. We'll talk more about that in a few minutes, though. But you mentioned going to the ER a few
Yes,
times.
Yes.
How many times did you actually go to the ER back in 2006 or
5.
so? 5 times?
5.
So very frequent arrhythmias,
Yes.
and affected you quite a bit.
Yes, and to the point where I will add, and I say this, I say this with all due respect, because whether it's conventional medicine, although I'm a full believer of naturopathic medicine, while my doctor, my conventional doctor at the time, was doing everything that she possibly could,
Mhm.
and I very much respect her and her practice, you know, it was to the point where she was telling me that I probably needed to go see a psychologist because she thought it was more mental, because based on all of the conventional testing that they
Mhm.
did, nothing was showing up.
Okay.
But yet I was still feeling really lousy.
EKGs,
Correct.
ECGs?
ECGs, the Holter, the stress test,
Mhm.
yeah, everything.
Okay. All right. You were taking all the right and typical conventional medicines to treat arrhythmias.
Mhm.
Calcium channel blockers and a beta blocker.
Right.
And typically one of the side effects is to make you feel tired,
Oh,
because it does slow down your heart rate to try to regulate the heart rhythm.
Right.
But yet it wasn't working.
No, well, it would subside,
Okay.
but it never eradicated.
Okay. Okay. And did your cardiologist ever talk to you about doing ablation therapy, or, you know, using a pacemaker at one time, or at some time?
She actually, yeah, and that was the fear of God in me for sure.
Mm.
But she never mentioned ablation therapy, but ultimately said that if the matter did not improve, or, you know, unfortunately got a little bit worse,
Mhm.
then I might have to have, you know, a procedure. And then ultimately she said maybe a pacemaker, but that would, you know, that was so far flung that she thought that just a procedure of some sort might be able to eradicate it.
Yeah. Typically, ablation therapy or a pacemaker for PVC is
Mhm.
usually not the right course. But I
Mhm.
guess if nothing is helping you, then that might be an avenue to
Right.
maybe go down.
Right.
Which I guess you really did not want to go down.
At all.
Okay.
At all.
Michelle, you mentioned that there were a few foods that
Yes.
would trigger
Yes.
the arrhythmias.
Yes.
Would you mind telling the audience which foods they were, or which foods you thought they might be?
Well, you know, it was, like I said before, it was mostly foods that were not healthy. If
Okay.
it was, you know, alcohol, if it was food that was heavy in carbohydrates, I unfortunately have a sweet tooth,
Okay.
and I noticed that if I had a dessert or two or bakery.
Okay.
Or a starchy type food.
Meal, a starchy meal.
Correct. It would tend to flare up.
Okay. So, you're not alone. Most people do maybe have a sweet tooth or enjoy sweets. So I don't think you need to feel bad about that. All right. So in 2006, you came in to see me. And, what did I tell you that was causing your arrhythmias and how well we're going to treat it?
You basically, it was kind of a very defining moment for me, to be perfectly honest, in that I was so hoping to have, as we talked earlier, I was so hoping to have a quick fix, because that's how I had been treated this whole time.
Right.
But yet it never completely eradicated my issue. But I was so hoping that you would tell me, take this supplement, do this thing, have this concoction, and it's all herbal and it's all good for you and you'll be fine in 2 weeks. But unfortunately that was not the case. But what you did explain to me made perfect and total sense. And it was about the body having too much toxins in it, and how a diet can severely affect symptoms or even exacerbate existing symptoms. You shared with me the fact that or actually before that, you asked me about my medical history, from a child. If I had been prone to a lot of antibiotics, during the course of my life, be it from infections or birth control pills or steroids. And unfortunately, I had been. As a little girl, I had severe allergies, so I had a lot of allergy shots. I had a lot of inner ear infections, so I took a lot of antibiotics. I was hospitalized when I was 2 with pneumonia, so I was, in that environment of a lot of medication at a very young age.
Okay. So we looked at your past medical history.
Yes.
Being exposed to a lot of antibiotics, corticosteroids for allergies. As potentially producing an imbalance in your body, which might produce a lot of enzymes that typically don't belong in the body and might affect your heart.
Yes.
Right. And would you mind telling the audience what we diagnosed you with? I'm sure they probably already know. But go
absolutely.
ahead.
You told me that I had an overgrowth of candida, a fungus in the body that basically exists in the gut and in the intestines, and when it's overgrowing to a point where it's creating these symptoms or exacerbating the symptoms, it can get into your bloodstream and wreak havoc and cause even more issues. And while I was familiar with that term, I wasn't, to be perfectly honest with you, ready for the diagnosis, but we'll talk more about the success of that later.
Okay. So, we talk quite a bit about systemic candida infections or fungal infections on Island Wellness. So if the audience follows the program on a regular basis, they've seen multiple patients coming on and who had skin problems like eczema or psoriasis, or had fibromyalgia syndrome or rheumatoid arthritis. And we were diagnosing these individuals also with a systemic candida infection. But the candida infection can produce multiple problems. And in different individuals, the main symptom would be a little bit different. In your case, the heart palpitations.
Right.
All right. So I'm sure the audience is going, oh no, not again. This guy thinks systemic candida infections cause everything.
Well, but you know what though, honestly, Dr. Uchida, it kind of does. Well, I shouldn't say it does, but I remember like clear as day, like it was yesterday, when you handed me the paperwork, and at the very top it says symptoms of candida. And it listed, literally, I mean, it has probably about 50 different symptoms. And honest to goodness, I mean, as God is my witness, almost every other one of those were like, that's me, that's me, that's me.
Right.
And it really does. I mean, it has a very widespread blanket, I guess, for lack of a better word, over your system.
Yeah, it does. It is a systemic infection. It could affect many, if not all, organ systems in the body.
Wow.
Did going through the medical book help you
Absolutely.
understand systemic candida infections, how they're caused,
Absolutely.
and then what kind of problems they can produce?
Absolutely,
Okay.
absolutely. To the point where I think I even told you, I said, "Did you write this just for me? Did you write?" Because it just seemed like it was so perfectly, matched with me. And going back to what I said earlier, I was so hoping that you would be able to understand my plight, and not only was it that you not only understood it, you typed it up just for me. I mean, I know you didn't, but it was right there. And going to the medical book and even the Bible, the book of Leviticus,
Right.
was amazing.
About half that chapter is on how to get rid of fungus.
That's
and how
right.
bad fungal infection, or how bad fungus is when it comes to affecting the human body.
Right.
So I found that very fascinating
Yeah.
myself.
Yeah.
So when I told you about a systemic fungal infection,
Uh-huh.
how that could be affecting your hearts and the rhythm of your heart,
Yes.
besides what were you thinking? What did you think of the treatment that I suggested you follow?
I thought it was severe at the beginning. I was like, oh my gosh, I need to muster up every ounce of will that I possibly can have to not so much, and I'm being a little bit facetious, but to really exercise the discipline. But personally for me, it was more, as I mentioned to you earlier, my situation to me mentally, more than physically, was so severe that I was willing to do anything. I wanted relief. I wanted to feel like I was on the road to recovery.
Okay.
And I had the faith, knowing that what you do, and the fact that I was highly recommended to come and sit with you. I knew that I was going to get some relief somehow, some way.
Okay.
And if I was patient through the process, I would be able to have a victory on the other end. What I didn't realize was that it would kind of be a little bumpy process. The journey would be a little bumpy.
It's not a smooth, easy process where you just get well in a few weeks.
No. But like anything, if you're a professional athlete, if you're, any successful person, that there's pain before pleasure. There's like they say in sports, no pain, no gain.
Right.
Truly, and it wasn't physical pain, but it was more just the mental toughness that
Right.
to go through the process.
Oh, so Michelle, before we talk about the
Yeah.
treatment,
Okay.
I wanted to ask you about the other symptoms that you felt, along with the
Sure.
arrhythmia, the anxiety attacks, and the dizziness and vertigo. You also experienced a few of the symptoms that you had mentioned.
I did. Mood swings, irritability, lack of concentration, diarrhea. I had also was just very fatigued, lethargic, just a general overall malaise, really. I just didn't feel like concentrating, didn't feel like contributing, didn't feel like doing much of anything.
Okay. Would you mind sharing with the audience, because when they hear about diarrhea, they might think, she has it once every few weeks, it's not a big deal.
Right.
Would you share it with the audience
No,
a
I
little
had it
bit
a lot.
more about your symptoms? Sorry to pick diarrhea as a symptom.
That's okay.
But you can talk
That's
about
okay.
the other ones, like difficulty in concentrating, or bloating, abdominal pain.
Yes. It was one of those things where the harder I tried to concentrate or focus, the worse it got. Because it was like I was compounding the issue. And the more frustrated I would get, or the more fatigued I would get, or the more disappointed or just kind of disheartened I would get. And sometimes even, again, if the mind starts racing, the heart would start to race, and then
you trigger the arrhythmia.
and then the anxiety would come on.
Okay, so they were all related and
Truly.
tangled together,
Truly.
basically. So would you mind sharing the treatment that we put you on?
Sure.
I know you had mentioned that it was pretty intense.
Yes. But just for a short period of time.
Okay.
Short period of time.
Which foods did you have to avoid, and which foods could you have?
I basically ate dirt. No, I'm
Okay.
kidding. I'm totally kidding. I'm totally kidding.
You might want to cut that out.
Yeah, sorry. I basically, you had encouraged me to cut out all simple carbohydrates.
Okay.
All of the white stuff, sugar, flour, white rice, bread. I also fruits.
Even fruits, healthy things.
Yes, even
right.
fruits, with the exception of papaya,
Mm.
which was my saving grace.
Okay. Did you like papaya at that time?
I did not. I learned quickly.
To love it?
I love it now. I
Right.
love it now. It's my best friend, to the point now where people, if I'm out at a breakfast meeting or something, they're like, "Are you going to have your papaya?" And I'm like, "Of course I am.
alright,
Of course I am."
okay, alright.
So I'm Princess Papuli and her papayas. But I also, because you wanted to ward out any food allergies, I also did a hypoallergenic. So all of the foods that are common in food allergies, so eggs, dairy, cheese, all of the foods basically that I love. All that I love.
Mhm.
Pastas.
Tomatoes. Corn, soy.
Correct.
Mhm.
Correct.
Peanuts.
Correct.
Pistachios, macadamia nuts. So a lot of foods.
A lot.
I mean, a lot of patients ask always, well, what do I eat?
Right.
And what did you choose to eat more of at that point?
It was not only an exercise in discipline, Dr. Uchida,
Mhm.
it was also an exercise in preparation. That was absolutely key, because it's if I were to come and see you today and say and you were to diagnose me and say this is the regimen that I would like you to follow, I would probably take a couple of days to prepare, to get
Mhm.
all of the foods ready. And even as the weeks go by, day in and day out, you have to plan and prepare your meals.
Right.
And with that, I had only organic meats.
Okay.
So beef, chicken.
Okay.
Fish, obviously not organic. Lots of turkey. I thought I
Okay.
was going to turn into a turkey. But it was great. It was
Yeah.
great because it's very high in protein, so I felt full very
Mhm.
quickly.
Mhm.
Vegetables, lots of vegetables, and I became very creative. I know you gave me a Candida cookbook, or anti-Candida cookbook,
Right.
which was very helpful, but you become very creative. I now make my own mayonnaise. I now make my own salad dressings. I now am able to, to love to have water with lemon, or iced green tea, or so your body does adjust, and once you get through that initial hump, and for everybody it's different, you start to soar. You start to really feel empowered
Okay.
by the regimen.
All right. You do have to plan ahead, right? Because it
Yes.
is completely different than probably what most
Yes.
people are eating today. But
That's
it's
right.
not foods that are not familiar to people,
That's correct.
right? Because also one of the big food groups that you can eat are beans.
Yes.
And did you eat a lot of beans?
I did. I ate a lot of hummus, which
Okay.
is garbanzo beans or chickpeas.
All right.
I ate a lot of, we made turkey chili, homemade turkey chili with, the organic chicken broth, and
Mhm.
with the kidney beans, black beans, garbanzo beans.
Mhm.
Ate a lot of those, a lot of broccoli, kale, spinach, Brussels sprouts. What a wonderful thing that I've discovered in terms of snacks was taking those vegetables and roasting them to the point where they become crispy, so
Oh,
they
yeah.
are like chips.
Yeah,
So
yeah.
you can have still that crunchy flavor.
Right,
So
right.
there's a whole host of things, and I believe now, versus maybe 10 or 15 or 20 years ago,
Mhm.
with the advent of like Whole Foods that's here now, and
Right.
you have a lot more access to a lot more healthier, more organic foods that are on, the
Right.
regimen.
It does make it a lot more available for you.
Absolutely.
You had mentioned a lot of vegetables.
Yes.
So most vegetables were right, except for
Corn.
corn, tomatoes, eggplant, bell
That's right.
peppers. You mentioned papaya would be the only fruit.
Yes.
Besides avocados.
Yes.
That you could eat. You probably
right.
ate a lot of nuts.
I did lots of almonds.
Okay, almonds.
Almonds, a lot of pineapple seed, or excuse me, pumpkin
seeds. Okay.
chia seeds.
Oh yeah,
Yeah,
Okay.
sunflower seeds.
All right. The diet was pretty dramatic change. A dramatic change. Was it difficult for you to follow?
In the beginning, and truthfully, it was only difficult because of the preparation. You know, I mean, and getting the food prepared. You know, I just in the nature of what I do during the day, I'm out a lot. You know, having dinners or at receptions, and so that was a little bit of a challenge for me because you know, when you're out, you know, people are either drinking or, you know, there's food that's being passed around, and that food certainly is not on the diet.
Right.
But you adjust and you accommodate. You know, and you know, I always had almonds in my car just in case I needed, you know, something. You know, and I felt a little hungry. Taro chips was another thing that I had a lot of with guacamole. You can make homemade guacamole. So there weren't, you know, I tried to create the menu as close to what I was doing, so I didn't feel like it was so severe.
Oh, very good, very wise. And it didn't seem severe.
No, not at all. Not at
All
all.
right.
Not at all.
We mentioned, you know, the dramatic change in your diet, but when I had told you that we'd be treating a fungal infection to help your arrhythmia, and that the main treatment was a diet change, did you think that treatment was nutty, crazy? It just couldn't work. How can a diet change?
A diet, yeah, exactly.
Help your arrhythmia, which the medications
did not.
Yeah, right.
You know, to be perfectly honest with you, in the back of my mind and in my heart, I knew it would work. But just in the forefront of my mind and just my immediate thought was, oh, really? Are you really? but I knew, I mean, when you really think about it, you know, there are certain foods, I'm sure if people take time to just to think, there are foods that make you feel a certain way. You know, people that eat for comfort,
Right.
you know, that makes them feel a certain way. So it's either a good thing or a not so good thing.
Right.
So I figured that, okay, if I string a lot of good things together in my diet, it's got to do something.
Right.
It's got to do something, and the side I shouldn't say the side effects, the wonderful serendipity of all of this, and I don't know if you want me to talk about it now, is the weight loss.
Oh, okay. We'll talk about that in a bit, though.
Okay.
All right. So we changed your diet.
Yes.
We also gave you a few supplements.
Yes.
Right. But the supplements had nothing to do with your heart, though.
Correct.
Right. They were all related to treating the candida.
Right.
And not treating the heart itself.
Right.
Right. So earlier, I know
Yes.
we didn't go through it together, but if the audience tuned in at the beginning of the program, I did mention that typically in naturopathic medicine, we're looking for two things when it comes to treating arrhythmias. The first is there a potential to have an imbalance of having too many what is called phospholipidase enzymes in the body that could be throwing off the cardiac rhythm. Or if it's not that, it could be an electrolyte imbalance, right? So not everyone who has arrhythmias will have a candida infection.
Right.
And there are some people that come in to see me with arrhythmias, and they've seen some of my patients on the programs before talking about heart palpitations
Right.
being corrected by treating the candida infection.
Right.
The heart palpitation, though, usually is one of many symptoms and not the major symptom. These individuals want to go on the candida treatment, you know, to help their arrhythmia.
Right.
But I tell them there's no indication to suggest you have a candida infection. So there's almost like this big letdown, like, oh, I don't? They're looking forward to go on the diet.
Wow, those lucky people.
Yeah.
Those lucky people.
So we give them electrolytes that help balance
Sure.
the nerve impulses inside of the heart. So I know you're probably thinking,
I wish that happened to me.
How come I didn't have that one? But unfortunately, we don't get to pick which treatment
That's
we
right.
undergo. But
That's right.
anyway, not all arrhythmias are caused by systemic candida infections, just so that you know. Maybe one day we'll have one of these other, or a couple of these other patients come on and share their stories about just treating the electrolyte imbalance and how it helped their arrhythmia.
That'd be great.
All right, so usually it's not going to create severe arrhythmias like ventricular fibrillation and those types of arrhythmias, but the more mild ones, yes. So you went on this diet, and you did it phenomenally.
Thank you.
You did really well.
You are an excellent coach.
And would you mind telling the audience,
Sure.
when did you start to notice the benefit of your treatment?
I started to notice, just as you and I have kind of dubbed them, there were, at the beginning there were lots of cloudy days, and I was just praying for sun. And I started to have some sunny patches. It was probably about a month and a half into, about 4 weeks, almost 5 weeks into the regimen, where I could have a note where I noticed it, you know, a noticeable difference.
Okay.
And then, you know, I would kind of take one step back, maybe 4 steps forward, maybe one more step back, 6 steps forward, you know, but I was constantly progressing, but it wasn't, you know, like, it wasn't a straight line, correct, correct.
That could have been tough for you at that time, wondering, you know, am I really getting better? Because I'm better some days and not others. When did you start to feel, let's say, so well that you weren't having hardly any arrhythmias and maybe no anxiety at that point?
It was probably about 2.5 months, almost
Okay.
3 months.
So it did take a while. It's not a
Yes.
quick fix.
No.
But you were feeling much better at that time?
Oh, way better, way better. And for me, it was not only physically, but just mentally, knowing that I was on the road to recovery.
Okay. So along with the arrhythmia and the anxiety attacks, how were your other symptoms doing?
They were subsiding. I mean, it was kind of like the you know, the diet was kind of like blowing off these little good bombs of health, you know, in my system, where it was like, you know, let's shoot the mood swings, shoot the anxiety, shoot the, you know, the dizziness and the sweatiness. You know, it was just, it was kind of knocking them out one by one.
So the symptoms were
They were subsiding.
resolving?
Yes,
Okay.
yes, yes.
Very good, very good. And when did the anxiety and the palpitations and the arrhythmia completely disappear?
It was probably, I don't know, I'd say a good 5 months, 6 months.
Okay.
Yeah.
So, and then you went through a period of it coming and going, or did it just
No,
stay
it would
away?
just, it was pretty much gone. I would maybe have, and I wouldn't even call it an episode, maybe one every 6 months.
Okay.
Or a year. I
All
mean,
right.
it was hardly ever. Hardly ever.
And was it a severe one where it lasted
Not
a long
at
time?
all. Not at
Okay.
all. I mean, to the point where I was like, oh, wow, oh. But it was gone, and I was like, oh, I forgot I had those, because I hadn't had one in so long.
All right. And you first came in to see me in 2006.
Yes.
So by about 2007, you were feeling...
Oh, I was feeling like $1 million.
All right, all right.
Feeling like $1 million.
And you look like $1 million.
Thank you.
You had mentioned you lost some weight.
I did.
Would you mind sharing with the audience how much weight you lost at that time?
At that time?
At that time.
It was almost, if I calculate it correctly, from the time before I saw you, I was a little bit heavier. It was close to 46 pounds.
46 pounds of weight loss.
Yes.
And that's a lot of weight for you.
It was a ton of weight, and to the point where, Dr. Uchida, people would say to me like, "Oh my God, you've lost so much weight," and I would think like, wow, was I really that big? Was I really that heavy? And I truly was, because I think I remember telling you that there was one day where I was bending down to pick something up, and I sprung right back up, and I was like, oh, my body feels so light. Because I wasn't carrying all of that weight, and I didn't realize how much weight I was carrying. Obviously anyway, yeah.
Well, close to 50 pounds. That is a lot of weight for anyone to lose.
Yeah.
Did the weight take 2 years to? Did it take you 2 years to remove the weight?
No, the first 3 months was probably the most, the quickest it fell off. My husband and I, we joke and we say that I didn't lose the weight, I released the weight, because if I lost it, I might find it again.
Okay.
So I released that weight. The first 3 months, it was probably about 22 to 5 pounds. That's, and you had told me that if it was no more than 2 pounds a week, it was still a healthy, way to release it, and a healthy way to, to get to the desired weight. Although that was so not the reason why we went through this, this journey. But that, and then over the course of time, because I was still very diligent about the diet, I still was releasing weight, but it just wasn't as dramatic as the first couple of months.
Right. That's one of the side benefits of treating Candida, changing your diet. I'm glad the weight loss came off, and it came off fairly easily for you.
Oh, absolutely. Yeah. And to be perfectly honest, while that, as I said, that was not the reason for it, that was kind of like a little bit of a motivation, like, okay, I can, bring on the foggy head, bring on the dizziness, bring on whatever it is that I need to go through, because, on the other side, I'm going to be lighter. So it was kind of the reward.
I'm sure many people noticed your weight loss.
Yes.
You must have had a lot of compliments.
Yes, I did, and yes, I did.
Okay, leave it at that.
Yeah.
What are your thoughts about naturopathic medicine now, and its ability to help potentially serious arrhythmias?
Oh, I would recommend it hands down. I mean, to the point where, again, like I said, I respect conventional medicine. I respect doctors and nurses and physicians, and it's a very, very worthy profession. And it does have its place. But I will say that for those that have chronic issues, and that for those that have been taking medication for a long period of time, to please seek naturopathic medicine first, or now, because while medicine does serve a purpose, your body is so much better off in the long run if you can heal it naturally. And mentally, you'll feel a lot better about yourself, because you know that you're empowering you to become a better you.
That's so true. Well said. Yes. So I'm sure the audience, they want to know, how you're feeling now, because that was about 5 years ago, right? That you were treated for the arrhythmia.
Yes.
How are you feeling now? How are you doing?
I feel great. I really do. I feel empowered again. I feel empowered that I know that I can help me heal. Versus relying on medication. And I know that when I come to see you, I know that you have the answer. I know that it's not a quick fix, because if the body healed itself overnight, then we wouldn't have doctors. We wouldn't have hospitals. We wouldn't have the medication that's so prevalent in society.
Right.
But I also am very grateful. This journey is as I shared with you, it's one that allows you to just kind of take inventory of you, and it allows you to really kind of just make sure that you are on the right course in life, be it family, work, if you have a spiritual life, physical, just a lot of things. And it really, I guess, because your mind becomes so clear and you become so pure, for lack of a better word, and even though I know you're not, but you know what I mean, where you don't have that toxin in you, you're free to have that, or you're liberated to be able to think, how can I better me, and how can I empower other people, to do the same. And it's not some voodoo spiritual, really deep kind of thing. It's really simple and very, very, very empowering in the process.
A lot of my patients do mention that after we're done with their treatment, is that they do feel very empowered because it was them who corrected their health issue, and they did it with diet and maybe some natural supplements. So, it's very empowering to know that you can overcome severe health problems
Yes.
that maybe even medications are having, or medicine is having a hard time with dealing with or correcting.
Right. Right.
Just to take us a little bit off subject,
Sure.
we did have a little setback a few days ago.
Yes.
You know, a lot of people are complaining about the foggy weather that we're having and the rain. We're actually going to be doing a television program on the fog and what we can do to help
Oh,
ourselves,
wow.
you know, in the
Great.
next few weeks.
Okay.
But you weren't feeling well.
No.
You were feeling like you had a lot of brain fog,
Mhm.
and you just didn't feel well. You didn't feel motivated. You
Correct.
were feeling, I guess, congested in the
Yes.
head.
Yes.
And you were maybe concerned maybe the candida was coming back.
That's right.
Would you kind of share that episode?
Sure, absolutely. I felt as if some of the symptoms were coming back. Not all of the ones that we had talked about earlier.
So not the palpitations?
Palpitations a little bit, but not to the severity that they were.
Okay.
You know, just the brain fog, a little bit of vertigo, dizziness,
Mhm.
just fatigue,
Okay.
lack of concentration, just overall malaise. And I thought, oh no, is it? You know, I hope and I pray that the candida is not coming back.
Mhm.
And my husband and I were thinking, how on earth could it? Because I've been so diligent with the diet,
Right.
you know, and knowing that how important it was to follow that regimen. And I did notice though that my head was just really tight, and my eyes were really not sore, but just kind of tight and a little bit watery.
Okay.
You know, and then my ears started to ache a little bit, and I thought, you know, I think it's more of my sinuses. And so I came to see you, and you, sure enough, thank the good Lord, said that it was not the candida, and told me that based on the weather that it was more sinus.
Right. So we had a look in your ears and
Yes.
your sinus cavity,
Yes.
and it was congested.
Mhm.
And what treatment did you do? And how are you feeling today? Because that was just a few
It
days
was just
ago.
2 days ago.
Right.
Yeah, 2 days ago. I feel like 90% better. I'm definitely on. I can see the forest for the trees, or let's say the sun has come out again.
We can hear it in your voice and
Thank
see it in
you.
your smile.
Thank you. Thank you. Well, thank you to you. But you prescribed some supplements for me for my sinuses, and for me to take them 3 times a day, which I was gladly willing and able to do, knowing that we had gone through this whole anti-candida treatment that I've. You could tell me to take a whole jar of them in one sitting, and I would. But I know you never do that. But and then to do a sinus rinse. And I specifically asked you. I said, I've done the neti pot, but you had preferred me to do the sinus rinse over the neti pot because it gets
into the back of your sinus cavity.
Correct.
So you wash actually the whole sinus cavity if
Right.
you use like a bulb syringe or a bottle syringe.
Right.
So you can express the water
Right.
deeper into the sinus cavity.
Right.
And typically if it's going back into your sinus cavity, you're going to have that water draining out through your mouth.
Yes.
And then you'll know you're doing the sinus rinse properly.
Right.
And how were you feeling after you
I
did the
felt
rinsing?
to the point now where I told my husband, you told me to do it twice a day, in the morning and then the evening. And I told him, I said, oh, this feels like us going to the spa. It was just, relief,
All right.
because even though my ears weren't draining and, all of a sudden, my sinuses were totally cleared, but I could feel the draining. And as I mentioned to you, I sort of have a dry cough, because I know that I'm getting that postnasal drip, so it is draining out of my ears. I wish I could do it 3 times a day, but it's probably not good for you.
Yeah, I wouldn't suggest 3 times a day. I mean, some
Right.
patients try to do it 3 times a day, but there's just so much irrigating going on,
Right.
and there it might damage
Yeah.
the mucous membrane lining.
Yeah, no.
But
it
yeah.
works. It
Yeah,
works.
very good. I'm glad you're doing well.
Thank you.
I'm sorry,
Thank you.
Michelle, our time is up. I want to thank you so much for joining us
Thank you.
on Island Wellness and sharing your amazing and
Thank
incredible
you.
story with us today.
Thank you.
And continued success at keeping the arrhythmia away.
Thank you.
I know it can be a tough thing, but it's a good thing, like what
Yeah.
you're saying.
Yeah, thank you very much, and thank you for you and all that you do.
You're welcome. I'd like to thank all of you for tuning in and joining us tonight. I hope you enjoyed the program and learned something of value. Our hope is that these stories inspire in you the hope that true health is attainable and you can have it whenever you are ready. Please continue to look for and tune in to Island Wellness. We have more incredible, heartwarming stories of people overcoming incurable diseases and illnesses in the next coming few weeks. Look for Ron's incredible story of being wheelchair bound by multiple sclerosis, but now he runs. If you're interested in seeing a nasty, ugly skin infection, tune in to watch how Naturopathic Medicine helped Dennis overcome his. Jason will update you on how he's doing with von Hippel-Lindau disease. If you're still wondering if Naturopathic Medicine can really cure psoriasis, Annette and Evelyn return after 2.5 years to show you how their skin is doing right here on Olelo Television. These are some great stories that I encourage you to tune in and watch. My name is Dr. Jason Uchida. Goodbye.